And next, we have Dr. Renard Burton, the resident physician of Johns Hopkins Hospital Department of Emergency Medicine, USA. Dr. Burton is Academy of Geriatric Emergency Medicine Executive Committee National Resident Representative, Society for Academic Emergency Medicine. He is also the Emergency Medicine Representative, Johns Hopkins Medicine Armstrong Institute for Patient Safety and Quality, and co-chair of Emergency Medicine Committee, Johns Hopkins Hospital Comprehensive Unit-Based Safety Program. Dr. Burton, because of the time differences, he has recorded his speech. Let's play this video speech from Dr. Burton.
Greetings, guest of the 2022 Dr. Wu Lieh-Teh International Conference. My name is Kyle Burton, and I am an emergency medicine resident physician at Johns Hopkins Hospital in Baltimore, Maryland of the United States. You're probably wondering, why is this guy who is not Malaysian born or ethnic Chinese, not an infectious disease specialist, and not a medical historian speaking on the legacy of Dr. Wu Lieh-Teh? Well, similar to all of you, in the world as we know it, the efforts of Dr. Wu impact several aspects of my day-to-day life. During my collegiate studies at a historically black university in Washington, D.C., Howard University, I was awarded the English-speaking Union Leward Morris Fellowship to study biochemistry at the University of Oxford. Beyond the academic rigor that I would soon face, the cultural shock with transitioning from my majority black environment to a place where I was the vast minority proved difficult to bear. In 1896, Dr. Wu was admitted to Emmanuel College of Cambridge University after winning the Queen's Scholarship. He would be the first student of Chinese descent to matriculate through the medical degree program at Cambridge University. As such, surely he faced pressures beyond what I could imagine, but he thrived despite all odds. His successful career at Cambridge entailed winning virtually all of the available prizes and scholarships in his field of study, including the Cheadle Gold Medal of Clinical Medicine and the Kurslock Scholarship in Pathology. After becoming the very first student of Chinese descent to earn his medical degree from Cambridge University, he qualified for prestigious opportunities to continue his studies with the Liverpool School of Tropical Medicine, the Pasteur Institute, Howe University, and the Selangor Institute. Needless to say, he overcame the odds of being placed in an uncomfortable and foreign situation. While enduring the worst of the COVID-19 pandemic, I served as both a collaborative member of the National Academy of Medicine's Action Collaborative on Clinical Well-Being and Resilience, and additionally as the emergency medicine representative for the Johns Hopkins Medicine Armstrong Institute for Patient Safety and Quality. Through these roles, I fielded countless concerns from my peers about their safety and their family's safety given the dangerous workplace factors. Our initial inadequate supply of N95 masks caused an uproar since this was the most reliable resource to keep us safe. As ecstatic as we were to finally obtain sufficient counts of this critical protective barrier, we had no idea who to thank for this invention. In 1910, while Dr. Wu was serving as vice director of the Imperial Army College near Beijing, a deadly plague started spreading in the northeast regions of China, reaching the large city of Harbin. Tens of thousands of people coughed up blood. Their skin pruned and turned purple. They all died. Doctors served their patients without protection, and the mortality rate among healthcare staff rose to 46%. At the time, China was in political turmoil. Russia and Japan were vying for control over Manchuria, and both saw the plague as an opportunity to advance their goals. Western countries at the time largely viewed China as a country overburdened by disease, opium addiction, and an ineffective government. With his unique and extensive clinical training, Dr. Wu had the social and political clout to be a catalyst for change. The Chinese government appointed him to investigate the disease, and his impact was immediately felt. On the third day of his arrival, he conducted probably the first ever Manchurian Plague victim postmortem, confirming the epidemic to be a pneumonic plague from organisms cultured from the lungs. Once ascertaining airborne spread, rather than flea spread as generally suspected, he instituted life-changing public health initiatives fraught with resistance. Despite proximity to the Lunar New Year, he recommended population movement restriction, especially on railways. He suggested mass cremation of infected corpses that had been piling upon frozen, impermeable ground, even though this practice was against the tenets of Confucianism. He ordered the old plague hospital to be burned down and replaced to sufficiently house victims, additionally isolating contacts and ordering progressive home sterilization. Most memorably, he designed and produced a special surgical mask with cotton and gauze, adding several layers of cloth to filter inhalations. Some, including a prominent French physician, doubted Dr. Wu's insight, guidance, and creation. Gerald Mesny came to replace Dr. Wu, and he famously balked at his pneumonic plague theory, saying, "What can we expect from a Chinaman?" Anti-Asian and anti-black sentiments remain pervasive today, as my colleagues and I have even faced racism from the patients that we serve. Mesny tried to further his point by attending the plague without wearing Dr. Wu's mask, but he died from the plague only 2 days later. The hidden beauty of these masks is that they could be constructed by hand out of materials that were cheap and in ready supply, all while protecting users from bacteria and empirical testing. Mask production ramped up, and soon medical staff, soldiers, and everyday people were wearing Dr. Wu's creation. Dr. Wu's leadership contributed greatly to the end of the Manchurian Plague by April 1911. Within only 4 months of being tasked with controlling its spread. Aside from defending against a plague that could have devastated China in the early 20th century, and perhaps spread far beyond its borders, the enforcement of public health measures gave the country more legitimacy, revolutionizing the approach to health. This response guided the subsequent protection against the 1920 and 1921 cholera pandemic in northeast China, and then the Spanish flu, scarlet fever, and anthrax afflictions. Companies around the globe increased production of similar masks to help abate the spread of the flu. My introduction to healthcare came through the mentorship of my grandmother's primary care doctor, Dr. James Whitcomb. He was a 98-year-old practicing physician who considered himself a lifelong learner, had once been president of the National Medical Association, and valued instruction of the next generation as the most important aspect of his legacy. These same desires, tenets that I will maintain throughout my career, were possessed by Dr. Wu on a much broader scale. As a lifelong learner, despite his accomplishments, Dr. Wu was awarded the Rockefeller Foundation Fellowship in Public Health for his Master of Public Health study at Johns Hopkins University. It is both inspiring and an honor to have the privilege of following Dr. Wu's footsteps at his alma mater. To further broaden the influence of his insight, he founded and became the first president of the Chinese Medical Association, the country's largest and oldest non-governmental medical organization. He trained doctors for the Chinese Army. In a long memorandum on medical education in China, Dr. Wu advocated radical improvements in training of medical students, including the adoption of human dissection and recognition of the value of post-mortems in systematic clinical teaching in hospitals. And he established the Central Medical Council and the essential use of English as a teaching medium in addition to Chinese. He also continued modernizing China's medical services by building hospitals and reorganizing the essential branch of the International Society of Preventive Medicine at various seaports. I could spend hours listing all of the awards and recognitions that Dr. Wu has earned, but I much prefer describing his impact. If any of us were given the chance, I am sure that we could draw parallels between our lives and that of Dr. Wu. The truth is, he was just like all of us, a common man, but he did the uncommon, the unconventional, the unexpected. He did what was necessary to change the world. He was the man behind the mask, the plague fighter, the father of modern medicine. Every time I walk through Johns Hopkins doors, I will remember his efforts at the same venue. Every time I face somebody with a respiratory illness, I will appreciate his advances that stopped this common viral illness from reaching pandemic proportions. Each moment that I strap on an N95 mask, I will know to thank his innovative approach to protect us all as we serve others. Please join me in paying respect to Dr. Wu Lieh-Teh, the man whose life-changing efforts a century ago continue to serve the world as we know it today. Thank you.